Hi, I'm Rachel Cathell, and on this episode of Western Chester County Checks In, we are visiting Penn Advisors in Sadsburyville. We'll be speaking with Carl Klingman about health insurance for your business. Thank you, Carl, for joining us today.
Thanks for having me, Rachel.
So tell us, what are the advantages of offering health insurance through a business?
So one of the advantages is really, first and foremost, to be able to attract and retain quality employees. The other advantage is that a lot of businesses can deduct the premiums for pre-tax, and the employees can have that come out of their paycheck on a pre-tax basis, provided they have a Section 125 plan.
Mm-hmm. So how would a business start this process and get the ball rolling?
So the process starts with filling out a census. A census is basically an Excel spreadsheet that has some basic employee information on it, employee names, dates of birth, and then if they're going to have any dependents, spouse, children enrolling on the plan, and the zip code where they live. And from there, we take that census and we go to the insurance companies and we analyze the quotes, and then we go back to the employer and start talking.
So how do they choose a plan right for their business?
So we have to keep in mind that health insurance is utilized locally. The health insurance carriers offer plans specific to the region where the employees are, specific to where the business is located. And that limits the choices that we have for the insurance companies, but it also limits the plans that we have. Maybe we need a specific provider or a specific hospital. We want to make sure that they're in the program depending on the needs of the employees. And we start to narrow down our choices from there. Okay,
and who must be offered the insurance?
So anybody that would be considered a full-time W-2 employee, 1099s don't count, they're not employees, they're independent contractors. And the employer has the ability to set a minimum of like 25 hours as considered full-time, up to a maximum of 40 hours. And then anybody that falls under those guidelines would be eligible for the benefits.
Okay, so is there any rules around how the business contributes to the policy?
There are some rules around that. The insurance carriers have very specific requirements. So the insurance carrier is going to require that the business pays 50% of the individual only premium. Now they're not obligated to pay any more, but in my experience, most businesses pay roughly 75% of the premium for the individuals, and oftentimes they'll pay between 25 and 50% for the dependents as well. And then the employee portion is going to come out ideally on a pre-tax basis.
So is there a benefit to paying more towards the insurance?
So the employer can pay more towards the insurance. Obviously, it's considered a nice benefit for the employee, but at the same time, that is a pre-tax benefit that the employee receives. So it's not an additional amount that's running through their payroll, so they don't have to pay payroll taxes on that. And it's a creative way for the business owner to give a little bit more and avoid payroll taxes.
So when it comes to a new hire, are there any rules for a new hire?
So the new hire has to be eligible for the benefits based on the Affordable Care Act law that says you can't have an employee wait more than 90 days to be eligible for the benefits. So most employers have a first of the month after 30 or first of the month after 60-day waiting period, and they would be eligible for the benefits.
Okay, and once a business signs up or a group signs up, what needs to be done moving forward?
Once the business signs up, a really good idea is to have an open enrollment meeting, and this is where you gather your employees and have a really good conversation on the benefits. If the employees don't understand the value or understand how the plan works, then they're never really going to appreciate the expense that you're paying in as the owner or as the business owner for the employees. We want them to understand the plans, understand the value that they're providing.
Okay, and who handles the administration?
So sometimes we have HR people, but a lot of small businesses don't have HR personnel. And this is where a good broker can come in and help with the administration, onboarding new employees, having employee changes, or even terminations, and handling COBRA paperwork, things of that sort.
Okay, and what is Section 125 programs?
So Section 125, also referred to as a cafeteria plan, This is a formal document that the business is required to have, and it allows the employer to withhold money from the employee's paycheck on a pre-tax basis. And it's a requirement by the Department of Labor in order to do so.
Okay. Thank you so much for providing insight today for our chamber members.
Thanks for having me, Rachel.
I'm Rachel from Western Chester County Checks In. Thanks for joining us. We'll see you next time.